Are you dealing with tech neck today?
Only in my neck.
Today, we're talking about how neck pains contribute to headaches. So join us today on the 50 Shades of Pain show. Welcome to the 50 Shades of Pain show, where we empower our community with knowledge about pain, both physical and emotional, to give you the tools that you need for optimal health. I'm Dr. Donish, Medical Director of WellWord here in Lexington, Kentucky, and I'm here with my co-host, Dr. James Escaloni. And today we're talking about a very often misunderstood or underdiagnosed reason people get headaches, and that is
Neck issues.
Yeah, we just did an episode on exercises that you can do to keep your neck strong. But frankly, it's a recommendation I have for people who even get headaches, because so many different types of headaches are really originating from the neck, and it just often goes undiagnosed or misunderstood. So, James, why does the neck contribute to the headache?
Well, there's a lot of different moving parts from the neck that go all the way up to the head. If you look at your anatomy books, there's even muscles all the way up in your middle back that attach to your head. So that's got to be a part of it. Same thing with all these different joints that are in your neck. If there's a little problem, something's disjointed in that neck, it could cause some problems. Heck, even your own jaw. Take a look at this spot right here. It was in the space where I put my thumb. You have your jaw, your head, and your cervical spine, all of them touching in this little spot. So if there's a little problem between any of those, yes, there could be one that's misbehaving and the other one's trying to make up the difference for that misbehaving little guy.
Yeah, there's a lot of theories for why people get headaches. It ranges everything from a nerve being irritated to blood vessels being dilated or constricted to metabolic byproducts or essentially the debris that builds up from thinking too much or having too much emotional stress. Metabolites, where those byproducts can irritate the skin lining the spine. Our brains are like a little walnut covered with nougat and then has a kind of a milky chocolate around it. I don't know if it's
really
that
hungry right now.
But in other words, you've got the brain and some fluid and then a hard shell around it. Well, between the hard shell and the fluid is a thin skin, and that can get irritated. It's called your dura mater. And it really relies on proper flow and circulation of the cerebral spinal fluid, essentially the lubrication or the fluid that surrounds your brain. If there's any kind of blockage in your neck or a limitation in the circulation, that fluid turns over multiple times a day. And if it doesn't do that in a proper manner, then you can get an accumulation of metabolites in an area which can be very irritating to the brain and the skin overlying the brain.
Mm-hmm.
So proper movement of your neck allows for that circulation to take place, that fluid circulation, but it also has a lot to do with the nerves that go up the back of the head and into the face. The nerves that go in those directions are sandwiched between layers of muscle. And if your neck is not working the way it should, the redundancies of the body mean that muscles can act in the place of what ligaments should be doing. But in doing so, they'll compress the nerve and over time create friction and irritation and cause pain going up the back of the head or across the front of the face.
And if you have a history of migraines and you have legitimate migraines for whatever reason, then you start to have neck pains too. The neck pain will not only make the migraines worse, but it can actually kick off a migraine when your body was saying, I don't know, should we have a migraine? What do you think, neck? Yeah, I hate this person. Let's give them a migraine. And that's why we got to help you guys.
What's also really interesting is that the joint that connects your skull to the first bone of your neck and then the second bone of your neck, those joints are, the nerves going to those joints are the same nerves that go up the back of your head. So there's a strong connection between the joints and neck pain and headaches, because when those guys get irritated, your spine can't really tell where the signal is coming from, and it just kind of blends it all in together and thinks the pain is all over the place. So keeping a healthy neck, or if you're having a headache, figuring out what's unhealthy about your neck can be a major step in figuring out the long-term treatments for chronic headaches.
A lot of times, all it takes is a little bit of hands-on therapies to your neck to get things loosened up, moving again. Some either dry needling or acupuncture can help calm things down. And that'll take the big pains to little focal spots. That's something that we do often here, where sometimes when it seems like everything's a little bit beaten up, we got to calm some things down, make it a little more focal. And then all these wonderful tricks that we have at Wellward, we can now figure out, oh, that's the spot that keeps hurting. We got something for that.
Yeah, if you're getting Botox injections on a regular basis, there's a good chance that there's a neck component to it. And if we're able to tease that apart and figure out where the origin of that is, there are some better long-term solutions than having that perpetual cycle of Botox injections.
Definitely.
So if you're dealing with neck pain, please give us a call, look us up. We just did a really good podcast talking about this in greater detail, but by all means, if we can help you, please call our patient navigator at 275-HURT,
Or
H-U-R-T.
878.
Yep, that's 859-275-HURT. So for all of us here at Wellward, I'm Dr. Donich,
And I'm Dr. Escaloni.
and we're wishing you growth and joy on your Wellward way.